Welcome back to the channel. In this video, we are going to see about Bordetella pertussis. Introduction. Bordetella pertussis is a gram-negative aerobic pathogenic encapsulated Cacobacillus bacterium of the genus Bordetella and the causative agent of pertussis or whooping cough. Classes Beta Proteobacteria. Genus is Bordetella. Scientific name is Bordetella pertussis. Phylum is Pseudomonota. Domain is Bacteria. Family Alcygenaceae. Order Burkholderoides. General characteristics. Size small, approximately 0.8 mm to 0.4 mm. Shape is rod shaped, cockeyed, or ovoid shape. Gram's classification is gram negative. Capsule is present. Respiration aerobic. Arrangement is single or small in groups. The pH is 7.0 to 7.5. Habitat is human respiratory tract. Pathogenesis of Bordetella pertussis. Attachment and colonization. In attachment and colonization, first it transmit. Bordetella pertussis spread through respiratory droplets from infected individuals. Then attachment. The bacteria attach to the ciliated cells in the respiratory tract through various adhesions, including filamentous hemagglutinin and fimbriae. Tissue trophism. Bordetella pertussis preferentially colonize the upper respiratory tract, particularly the nasopharynx and trachea. Proliferation. Once attached, the bacteria multiply rapidly. Virulence factors and their effects. Toxins. Pertussis toxin. This toxin affects various host cells, including leukocytes, and disrupts G protein signaling, potentially contributing to the extreme lymphocytosis seen in pertussis. Adenylate silase toxin inhibits phagocytosis by macrophages and other immune cells, avoiding Bordetella pertussis to evade the host defenses. Tracheal cytotoxin cause tissue damage and inflammation by damaging the respiratory tract cells. Systemic manifestation. Beyond the respiratory symptoms, pertussis can also lead to systemic complications including lymphocytosis, post tissue vomiting, and severe cases neurological complication. While the exact mechanism linking Bordetella pertussis infection to these systemic effects are not fully understood, other toxins are thought to play a role. Evasion of host defenses. Bordetella pertussis can also evade host defense through various mechanisms, including the production of toxins that interfere with the immune system's response. This can contribute to the persistence of the infection and the development of the severe disease. Pathogenicity of Bordetella pertussis. Adherence to respiratory epithelium. Filamentous hemagglutinin. This protein allows Bordetella pertussis to adhere to the ciliated epithelial cells of the respiratory tract. Petacitin, another adhesion that helps Bordetella pertussis adheres to the host cell. Pili. Pili are hair-like structures that also contribute to bacterial adhesion to the respiratory epithelium. Toxins produced. Bordetella pertussis produces several toxins that contribute to its virulence. Pertussis toxin. This is the main virulence factor and an exotoxin. It enters host cells and interferes with the regulation of adenylate silase activity, leading to increased cyclic AMB levels. This disrupts normal cellular functions and contributes to symptoms like coughing. It also inhibits immune cell function, impairing the host defense mechanisms. Adenylate silase toxin. This toxin increases CAMP levels in host cells, weakening immune response and causing local tissue damage. Tracheal cytotoxin. This toxin damages the ciliated epithelial cells of the respiratory tract, leading to cell death and the subsequent disruption of the mucociliary clearance system, which is essential for the clearing pathogens from the respiratory system. Demonocritic toxin. It is involved in causing localized tissue damage and potentially contributing to inflammation. Lipopolysaccharide. This component of the outer membrane can cause an inflammatory response. Immune evasion. Bordetella pertussis has mechanism to evade the host immune system. The pertussis toxin impairs immune cell signaling, especially the functions of neutrophils and macrophages, which weakens the host immune response. Bordetella pertussis can also persist in the respiratory tract, despite the immune system effects, contributing to the chronic nature of the disease. Invasion and colonization. The bacteria do not invade deep tissues but rather remain localized in the upper respiratory tract. They colonize the cilia of the respiratory epithelium where they replicate and produce toxins that lead to the characteristic symptoms of pertussis such as coughing fits and difficulty breathing. Inflammation. The toxins, particularly pertussis toxin and tracheal cytotoxin, induce an inflammatory response that results in tissue damage, inflammation, and airway narrowing. This contributes to the characteristics of whooping cough as the air is forcefully expelled from the lungs due to the airway obstruction. Clinical manifestation. The main symptoms of pertussis, which appear in stage, are largely due to the pathophysiological effects of the toxin. Catarrhal stage. Mild symptoms resembling a common cold, runny nose, mild cough, and low grade fever. Parasomal stage. Severe spasmodic coughing fits followed by characteristic whooping sound. Clinical disease. The bacteria spreads through respiratory droplets when an infected person cough or sneeze. The disease progresses through stages. Catarrhal phase, parasomal stage, and convalescent phase. In catarrhal phase, the initial phase resembles a common cold, with symptoms like nasal congestion, sneezing, and a mild cough. Parasomal phase. This phase is characterized by the hallmark whooping cough, where a series of violent coughs are followed by a high pitched whoops sound as a person inhales. Convalescent phase. This is a recovery phase where the cough gradually subsides but can last for several weeks or even months. Methods. Laboratory diagnosis of Bordetella pertussis. Methods. Culture, polymerase chain reaction, and serology. In culture, the gold standard are used. Polymerase chain reactions are also called PCR. Serology are used blood test. In symptoms, severe cough, vomiting, exhaustion, difficulty breathing, facial redness or turning blue, gasping of air, rib fracture, sneezing, nasal discharge, fever, sore and water eyes. Prevention and treatment is vaccination, DTAP, diphtheria, tetanus, pertussis, hygiene and prevention, good hygiene, stay home when you're sick. Antibiotics are erythromycin, azithromycin, clarithromycin. Thank you.